Hello everyone. In this section I will discuss about gross features of uterus. It includes the position, relations, supports, blood supply and clinical features. So coming to the location of this uterus, what you are seeing, this is the superior view of this pelvis. Okay, we'll see the pelvis. Okay, here this is the hip bones. Okay, hip bone with this sacrum and this the coccyx. Okay, the part of the hip bone, this region, that is the ilium. Okay, this region from here to here, that is the pubis. This part, that is the ischium. This is the pubic symphysis. This is the sacral promontory. Here this forms the pelvic brim. The part inferior to this pelvic brim, that is the lesser pelvis. Okay, so the location of this uterus, that is in the lesser pelvis. What you are seeing, this is the superior view of this lesser pelvis. Anteriorly, it's anterior, this is the posterior. Anteriorly, the urinary bladder. Posteriorly, that is the rectum. See, this is the uterus. Okay, here from this lateral angle of the uterus, there comes this fallopian tube or the uterine tube. Now, posterior superiorly, you can see this the ovary. This peritoneal fold here, this is the broad ligament. Okay, here you can see this the broad ligament, can see. Okay, so it's in the lesser pelvis. Then here you can see this is the sagittal view of this uterus. See, this is the anterior, this is the posterior. Sagittal view of the female pelvis. Okay, this is the urinary bladder. Here you can see this is the uterus, this is the rectum. This one is the fallopian tube or the uterine tube from here like this. This is the ovary. Okay. Then see the position of the uterus. Okay. It is slightly bends forwards. Okay, this is anterior. It's bends forwards and bit downwards towards the superior surface of this urinary bladder. That position is called the anteverted and anteflexed position of the uterus. Okay, this is the anteverted and anteflexed position of the uterus. See this part from here to here, this part is the body of the uterus. This part, this is the cervix. This is the cervix of the uterus. Okay, here this is the vagina. This is the urinary bladder. This is the urethra. This is the anal orifice. Then, so the normal position of the uterus, that is the anteverted and anteflexed position. Okay, see this is the body. This part is the cervix. Here you can see this is the urinary bladder. The surface, that is the superior surface of the urinary bladder. Okay, it's posterior. Okay. So here in this lateral view, here there is this the body, this is cervix. Okay, this is a long axis through this cervix, that is the axis of the cervix, like this. See the axis through the vagina, this region is the vagina, this part is the vagina. In blue color, that is the axis of the vagina. Where it meets, that meeting point here, where you get an angle, that is the angle of the anteversion, that is 90 degree. Okay, then here again, this is the angle axis through this cervix. This one is the axis through the body of the uterus. Okay, here there is an angle meeting point, there is the angle, that is the angle of the anteflexion, that is average is 125. It ranges from 120 to 170 degree. The anteflexion, this angle helps to the uterus, that makes the uterus slightly bends downwards. The anteversion makes the uterus slightly bends forwards. So forwards, downwards, that is the normal position of the uterus. Okay. Then here also the same sagittal view of this female pelvis. See, this is a sagittal plane, through the sagittal plane. This is the anterior, this is the posterior, the sacrum, this is the coccyx, pubic symphysis, urinary bladder. This is the uterus. Okay, this from here, this is the cervix. This part is the body of the uterus. This is the rectum. Okay, see, this is the vagina. Here you can see this is the uterine tube or fallopian tube with this ovary posterior-superiorly. Okay, this is the lesser pelvis. Here that is the same only. Then coming to the parts and features of this uterus. Okay, we know the uterus is a important reproductive organ in females. It protects and provides nutrition to the fertilized ovum, okay, which helps to grown into a fully formed fetus. Okay, then see here, this is the uterus. Okay, the part from here to here, this is the body. Okay, this one, this narrow part, this is the cervix. Okay, then see, this is the lateral angle or angle of the uterus where this fallopian tube attached or fallopian tube comes. Okay, here. Then the part of the uterus above this fallopian tube, above this dome shaped part, that is called the fundus. That is called the fundus. Okay, here there is a constrictor part. Here this is the isthmus. There starts, this is the cervix. That part is the cervix. This is the vagina. That is the posterior wall of the vagina. You are seeing this is the anterior view. This is the posterior wall of the vagina. You are seeing. Okay, so here this part is the cervix. Okay, then so cervix is projecting into this posterior wall of the vagina. Okay. Then moreover, you are seeing this is the uterine cavity. This part is cut. You can see this is the uterine cavity. It is triangular. This is not, it's, you can see the anterior surface also. And this is the uterine cavity. It's triangular in section. Here there is the cavity in the cervix. That is called, this cavity is the cervical canal. Okay, that is the cervical canal. So parts are the fundus, body and cervix. Okay. Here you can see this is the fundus, this is the body, and this one is the cervix. This. Then in this figure also you are seeing first one is the coronal view. This is coronal view, this is the lateral view. Okay, so this part is this fundus. Okay, this anterior view. This is the posterior wall of the vagina. See, from here to here, this is the body. This part is the cervix. Total length of this body is 5 centimeter. Total length of the cervix is 2.5 centimeter. So its total, that is the 7.5 centimeter in length. That is uterus, 7.5 centimeter in length. Is average, it's 40 grams. Okay, but it increases in size and shape during the fertile period of the female. Then see this triangular shaped, this region, that is the uterine cavity. Here you can see there is a cervical canal cavity in the cervix. Okay, so uterine cavity communicates superiorly to this fallopian tube. Okay, it's towards the fallopian tube, inferiorly to this vagina. Okay, where it communicates inferiorly to the vagina, that opening here, that is called the external os. This opening here, that is the external ostium or external os. Okay, here it communicates with this uterine cavity. The cervical canal is communicating with the uterine cavity superiorly. This opening, that is called the internal os. There will get the internal os. The part between this internal os and external os is the cervix. Okay, see again the cervix. See the cervix, it is projecting into the vagina. So the part projects into the vagina, that is the vaginal part of the cervix. Okay, the part above that, that is the supravaginal part. So two parts, supravaginal part, and this is the vaginal part of the cervix. Okay. So it projects into the vagina and forming some spaces that are called the phonesis or phonics. Here in the coronal view, you can see these are the lateral phonics. See, these are the, here the space, these are the lateral phonics. This in the sagittal view, here this is the anterior phonics and this one is the posterior phonics. Okay, that spaces forms, those are called the phonics. Okay. Then next, here you can see in this cervical canal there are mucosal ridges, longitudinal mucosal ridges with numerous lateral folds. These are called the arbovitae uteri, which helps to close this cervical canal. Okay, this arbovitae uteri. These are mucosal ridges, longitudinal and lateral, or this oblique ridges. Then coming to the shape of the cervix. See, in this nulliparous woman who has never given birth, the shape of this external os towards the vagina, that opening, is round in shape, small round in shape. In multiparous women who have given birth, woman who gave birth, okay, those that opening appears as somewhat triangular, widened and expanded. It's almost the shape of a fish mouth. Okay, so this is in the multiparous woman, the shape of this cervix. Okay, this is in the nulliparous woman. Then next is this relations of this uterus. See, this is the sagittal view of this female pelvis, antepubic symphysis, sacrum coccyx. This is the rectum posteriorly. Anteriorly, this is urinary bladder. See, this is the uterus. Above the green, that is the fundus and body. Below the green line, this region is the that is the cervix. So anteriorly, it relates to this which organ? This is the urinary bladder. Posteriorly, it relates to the rectum. Okay, that's about the visceral, main visceral relations. Superiorly, actually superiorly we'll get this one, that is the coils of this intestines. Okay, that is the ileum and this coils of the large intestine we get superiorly. Then coming to the peritoneal relations. Okay, so peritoneum, we know it's a serous membrane which lines the abdominal cavities, that is called the peritoneum. Here, this is the sagittal view. This is anterior, it's posterior, its organs, everything is labeled. This green color, that is the peritoneum. Okay, this is the upper and middle third from the rectum. Fold is going to the posterior surface of the uterus. Then it's going. Then it is lining the anterior surface of the uterus. Okay, then it's going to the superior surface of the bladder to this anteriorly. Okay, so this is the peritoneal fold. The fold which presents posteriorly, that is the recto-uterine fold. The fold of peritoneum which lies anteriorly, that is the vesico-uterine fold. Okay, that space there, it forms a pouch there posteriorly, that is called the recto-uterine pouch of Douglas, and also it forms a pouch anteriorly, that is called the utrovesical pouch. This space, this is the utrovesical, this is the recto-uterine pouch. Actually, this recto-uterine pouch, okay, which lies, the deepest part lies some 5.5 centimeter above this anal orifice. Okay, and also this is the dependent part, most dependent part of this peritoneal cavity. So if there is any infection or injury is there, fluid or pus, okay, fluid consists of pus and blood tends to collect there. Okay, that can be drained either through this anal or through this vagina. Okay, then so this recto-uterine pouch, anteriorly it's the posterior surface of the uterus and posteriorly is the anterior of this rectum. Utrovesical pouch, Anteriorly, there is the superior surface of this bladder. Posteriorly, this is the anterior surface of the uterus. That's about the rectouterine pouch and this uterovesical pouch. Then here you can see the other peritoneal relation, that is the broad ligament. So this is the broad ligament. See the uterus, this is the body, this is the cervix, this is the lateral border of this uterus. There a peritoneal fold attached, double laid fold of peritoneum attached, that is called the broad ligament. Okay. Actually this is the posterior view of the uterus. This broad ligament, it's a double layered peritoneal fold, okay, which has anterior and posterior surface. This is the posterior surface, the part in front that forms the anterior surface. Okay, the posterior, you can see this is the uterine tube, fallopian tube of then the ovary. Ovary you can see in the posterior layer of this broad ligament. Okay, then see this is the lateral and inferior part of the broad ligament. This is the medial border of the broad ligament. The medial is attached to the lateral border of the uterus. This lateral and inferior is attached to this pelvic wall. This anterior, this posterior, front anterior layer continues superiorly and forms the upper border. That part is free. Here the broad ligament is free. It's not attached anywhere. Okay, it is continuous. Okay. Then that's about this features of this broad ligament. Then coming to the contents of this broad ligament, that is the contents structures present in that. One is the fallopian tube or the uterine tube. This is the ovary. Then here, see this is the lateral angle. Here a ligament connects from this ovary to this uterus. This is the ovarian ligament. So this is the ovarian ligament. Okay, a ligament from this ovary to the lateral pelvis. Okay, from this tubal pole where this fallopian tube attached. This is the suspensory ligament. It is the suspensory ligament of the ovary. Okay. Then the part of the broad ligament between this uterine tube and this ovarian ligament, and this one, that is the ovarian ligament, this part is called the mesosalpinx. That is called the mesosalpinx. So the part of the broad ligament between this uterine tube and the ovarian ligament, that is the mesosalpinx. The part of this broad ligament below this ovarian ligament or this ligament of the ovary, this is called the mesometrium. That is called the mesometrium. Okay. Then see the ovary, it is lies over this broad ligament. That region is called the mesoovarium. That is called the mesoovarium. These are the subtypes of this broad ligament. Okay. So this broad ligament, it's a double laid fold of peritoneum from this lateral of this uterus to the lateral pelvic wall. Okay, this region, this is the mesosalpinx, this is the mesometrium. Here you'll get the mesoovarium. The contents are the uterine tube, then the ligament of the ovary, then this ovary, then additional to that we'll get the uterine vessels, uterine artery, uterine vein, lymphatics and nerve plexus will be there. Okay. That's about this broad ligament. It comes under the peritoneal relations. Here you can see the contents of this broad ligament. See this is the uterus, this is the body, this part is the cervix. This is the coronal view. This is the through the coronal plane, coronal view. Here this is the broad ligament. Their contents are this uterine tube or fallopian tube. See this is the ovarian ligament, Then here you can see there is the ureter. Ureter is there. See here, this is the ureter. Okay, then additional to that we get the uterine vessels, lymphatics and the nerve plexus. That's about the broad ligament and the contents. Then here visceral relations I already mentioned. Here this is the anteriorly it's the urinary bladder, posteriorly we'll get the rectum, superiorly we'll get the intestine. Okay. Then next is the supports of the uterus. Okay. So uterus, we know it's a muscular mobile organ which undergoes extensive changes in size and shape during the fertile period of females. So it is supported from sagging down by a number of factors, okay, which forms the muscular and fibromuscular supports. Okay, that forms the primary supports. Okay, so uterus is prevented from sagging down through the vagina by a number of factors. Okay, those forms the supports of the uterus, which includes mainly the primary supports that are the fibromuscular some structures. These are the fibromuscular structures. Then some muscular structures, muscles form some supports that comes under the mechanical support. These two forms the primary supports. Then next is the peritoneal folds, which act as secondary supports, additional supports. Okay. So we'll see one by one. Here. Before that, here we'll see this is the primary supports are the round ligament, uterosacral, transocervical ligament and pubocervical. This peritoneal folds, utrovesical, rectouterine, broad ligament. These three we already discussed. What is utrovesical, peritoneal fold, rectouterine fold and broad ligament. This forms the secondary supports or additional supports. Then in this fibromuscular supports or mechanical supports, position of the uterus. This also we explained. That is the anteverted and anteflexed position. This pelvic diaphragm, urogenital diaphragm, perineal body and these ligaments we'll see. Here. See, this is the anterior aspect, lateral view. This is the posterior. Okay, bends downwards, forwards towards the superior surface of this urinary bladder. See, from this laterally, okay, inferior to this uterine tube, inferiorly, there is a peritoneal, there is a fibromuscular structure comes. That is the round ligament. This is the round ligament. It is passing laterally, it is going then towards the deep inguinal ring, superficial inguinal ring. It exits, okay, out. Then it merges with the labium majus. Okay, so there is a fibromuscular structure which comes from this inferior aspect of this uterus towards, goes laterally, then finally it merges with this labium majus. That ligament is the round ligament of the uterus. You see, it is towards anteriorly it is going. So it pulls the uterus forwards. It pulls the uterus forwards. Keep in mind that. Then here in the superior view, here you can see the round ligament clearly. See, this is the uterus. This is the uterine tube, fallopian tube ovary. See this ligament. Okay. From this angle of the uterus, inferiorly. Okay, it goes laterally. Okay, then it merges with this labium majus. Okay, pulls the uterus forwards. Okay. Then one more other ligament in the posteriorly, there you can see another fibromuscular structure. That is a uterosacral ligament. That is it. Here you can see this is the uterosacral ligament. From the cervix of the uterus, okay, towards the sacrum. Second and third segments of the sacrum vertebrae. Cervix of the uterus towards sacrum. Okay, that ligament is the uterocervical ligament. This ligament pulls the uterus backwards. Okay, this round ligament pulls the uterus forwards, okay, which helps the anteverted position of the uterus. These two maintains the anteverted position of the uterus. Okay, that's important. Then next, here you can see this pubocervical ligaments, transvercervical ligaments, and the uterosacral ligaments. Okay. See, this is the anterior. See, this is the posterior. Here, this is the rectum. This is the cervix of this uterus. See, above in front, we'll get this one is the urinary bladder. Okay. Then there is a fibromuscular structure, fiber structure from the cervix, okay, from the cervix of the uterus towards the posterior of the pubic symphysis, pubic bone, that is the pubocervical ligament. Here, this one is the pubocervical ligaments. Okay, this is the pubocervical. Here you can see this is the pubocervical ligaments. Okay, then from the cervix, this is the cervix, okay, laterally towards this pelvic wall of the pelvis, this one that forms the transvercervical ligament. So this is the transvercervical ligament. Okay, this yellow color, that is the transvercervical or cardinal ligament or McEnroe's ligament. Okay, then from the cervix posteriorly towards the sacrum, that is called the uterosacral ligament. That is the uterosacral ligament. Okay, this also comes under the primary supports. Okay. That is the pubocervical ligament, transvercervical, uterosacral. Transvercervical is also called the cardinal ligament. Okay. Then coming to this muscular supports or this mechanical supports, let's say this is the pelvic diaphragm is there. See, this is the pelvis, lesser pelvis. This is the pelvic floor. Okay, floor of the pelvis is formed of some muscles. Okay, actually this pelvic floor supports this visceral organs, pelvic visceral organs. See, this is anterior. See, this is the urethra. Can see urethra, that opening. This is the part of the vagina. Can see. This is the rectum. Rectum is there. Okay. So these structures are supported by muscles. Those are called mainly the levator muscles. Okay, levator muscle. Here, see, this is the sacrum. From the sacrum posteriorly, one muscle is there, that is the piriformis. Okay. The next muscle is the levator. Levator. It's not there in this. Okay, see, this is the levator muscle. It has mainly three parts. The posterior most, this is the ischio-coccygeus, okay, or the coccygeus muscle. See, this part is the ischial spine. Here I'll get, this is the ischio-coccygeus, okay. Then this is the tendinous arch of the levator muscle. This muscle is the iliococcygeus. Here, this is the pubis. This muscle is the pubococcygeus muscle. These muscles forms the pelvic floor or the pelvic diaphragm. Okay, this is the one of the muscular supports of the uterus. Okay. Then here what you're saying, this is the coronal view. See, this is the cervix. See, this is the vagina. Okay, this is the opening vagina, vestibule of the vagina. Okay. See, this muscle, this is the levator muscle. That is the levator that forms the pelvic diaphragm. See, here you can see this is the external anal sphincter and deep perineal muscles can see. This is the external anal sphincter and deep perineal muscles we can see. That forms the urogenital diaphragm. There is the, through this urethra, this vagina is going to this urogenital diaphragm. Okay, that vagina is supported by this one, that is that one is the deep perineal muscles and this external anal sphincter. Okay. Then, so the mechanical supports here, what you're seeing, this is the pelvic diaphragm that is formed of this levator muscle. This is the levator muscles. Then there is a urogenital diaphragm is formed of this external anal sphincter and deep perineal muscles. Here we'll get the deep perineal pouch, that is the urogenital diaphragm. Okay. Then additional to that, one important support is there, that is the perineal body. What you're seeing, this is the pelvis, this is the perineum. Okay, from this inferior aspect. Okay, here you can see this is the anal sphincter can see. Here there is the vagina, this is the urethra orifice. Okay, it's the inferior view. Okay, this perineal body, it's not like fibromuscular nodal structure. Okay, it's present here. This is between this vagina orifice and this anal orifice. It's a fibromuscular node where 10 muscles are anchored. One is the superficial transverse perineum. Then there is the deep transverse perineum will be there deep to that. Then there is the bulbospongosus. These are paired. Okay. Then external anal sphincter. This is the external anal sphincter. These are the muscles attached to this perineal body. Okay. So which anchors, this perineal body anchors the pelvic floor muscles. Okay. So these muscles converge towards this perineal body. Okay. This also comes under the mechanical support of the uterus. So the supports of the uterus is important, actually supports is primary supports, which includes the fibromuscular structures. Is made up of fibers and muscles. Those are the round ligament, uterosacral ligament, transverse cervical, pubocervical. Okay. Then there it's made up of some muscles. Those are the some pelvic diaphragm, urogenital diaphragm and perineal body. That is, perineal body is a fibromuscular nodular structure where 10 muscles converge to that particular region. Okay. Then the secondary supports, these are peritoneal folds. Okay, that is the uterovesical fold, rectouterine fold and this broad ligament. Okay. Here, not here. Here you can see this is the anteriorly, this is the round ligament, and posteriorly this uterosacral ligament, which helps to maintain the anteverted position of the uterus. Okay. Here this is the pelvic floor. It's made up of mainly, that is the levator muscle. This is the levator. Keep in mind that is levator. This is to the levator. Here we can see the piriformis. This forms the pelvic floor which supports the uterus. Okay. Then this is the coronal view. Here you can see this is the urogenital diaphragm. That muscles forming the urogenital diaphragm also supports the uterus. Here this is a fibromuscular node in the median plane of this perineum. Okay, that forms the perineal body. Okay, where the 10 muscles converge, which anchors this muscles of the pelvic floor. Then that's about the supports of the uterus. Then comes the blood supply. See here, you can see this is the lateral margin. You can see the broad ligament. In the broad ligament, you can see this is the uterine artery, the arterial supply. This arterial supply, this is the uterine artery. Its uterine artery is the branch of this internal leg. It's lower 2/3. See, the upper 1/3 get it supplied through this ovarian artery. See, this ovarian artery is coming. It's a branch of the abdominal aorta. Upper 1/3 ovarian artery. lower 1/3, that is the uterine artery. Along the artery, veins accompanies. So venous drainage into this uterine veins and to the ovarian veins. Okay, that's the blood supply. Here, nerve supply, that is the autonomics through the sympathetic and parasympathetic. Parasympathetic, that is through the pelvic splanchnic nerves. Okay, S2, S3, S4. Okay. Sympathetic, that is to the T10, T11 segments of the spinal cord. Then lymphatic drainage. See, the lymphatic drainage is mainly to the, see, this is the external iliac lymph nodes, and this one is the, here you'll get the internal iliac lymph nodes. Okay. Then from the cervix, some is directly drains into the sacral lymph nodes. Lymphatic drainage into the sacral lymph nodes, external, and this is the internal. This is the internal iliac lymph nodes. Then, coming to the clinical features of this uterus, there is the one is the prolapse of the uterus. Okay. So we have seen the supports of the uterus. Okay, that is the fibrous structures, fibromuscular structures, and purely muscular structures which supports the uterus. Okay, we've seen the pelvic floor, the muscles forming the pelvic floor. We've seen the perineal body. Okay, then so during parturition, what will happen is there will can damage to this. Where is that figure? Okay, there during parturition, during the childbirth, there is a possibility of this damage to this perineal body and this muscle, that is the puborectalis muscle. Okay, here part of the puborectalis muscles or this vagina, that is called the sphincter vaginalis. Okay, that fibers gets ruptured. If it is not properly repaired, okay, there is a chance, there is a tendency of the uterus to sink down or sags down through this vagina, through this vaginal orifice. That is actually called the prolapse of the uterus. Okay. So here you're seeing this is the, here you can see this is the prolapse. Prolapse is the uterus bulges into this vagina. The risk is higher in us multiparous women who gives more childbirth. Okay, then also in women who is having chronic cough. Okay, then here there is the fibroids. Okay, here you can see this is the abnormal growth. Okay, these are benign tumors inside and outside the uterus that are called the fibroids. Okay, if it is outside, okay, this is the subserous type. Okay, in the muscular wall, okay, that is called the intramural fibroids. Okay, in the mucosal layer, that is called the submucosal fibroids. Okay, so this is the subserous, is outside. Okay, here you can see it is peduncles is there, pedungulated. Okay, so this is the subserous fibroids, submucosal fibroids, intramural fibroids. Okay, these are the abnormal growths. You can see inside and outside this uterus. This can see in this fertile period of females. Okay, then here you can see this is the endometriosis. Okay, this is the uterine cavity. This is the mucosa that is called the endometrium. The mucosal lining, that is called the endometrium. It's made up of the epitheliums. Okay, then the blood vessels will be there. Okay, so during menstruation, some blood flow, there is a backflow of the blood towards this uterine tube, to the pelvis. Okay, here we'll get the pelvic cavity, pelvis. Okay, and it gets stuck over this fallopian tube or the ovary or any part of this pelvis. From there it grows and forms the endometrial cyst. that collectively called the endometriosis. Okay, it produces severe pelvic pain, and actually the reason is unknown. One possible theory explains like this. Okay, so this is the endometriosis. This endometriosis fibroids are one of the reasons of the fertility issues in females. So that's all about this uterus, its parts, supports, blood supply, some clinical aspects. Try to find out more. Okay, we'll get so many aspects there. I explained only the important things, that is the fibroids and prolapse fibroids and the endometriosis. Hope you understood. So it is one of the essay questions. Okay, so describe the uterus, okay, with the help of the diagram with this position, that is the anteverted and anteflexed position of the uterus. Relations, which are the peritoneal relations and which are the visceral relations. Visceral relations, that is easier. Peritoneal relations, that includes the broad ligament, vesico-uterine pouch, recto-uterine pouch, and that fold. Okay. Then supports, that can separately ask for a short knot, the support of the uterus, which are the primary supports and the secondary supports. Then blood supply, this applied anatomy. Then also short knots on this pouch of Douglas and its importance. Then broad ligament. What is broad ligament? Which is parts of this broad ligament and contents of this broad